Welcome back. Now we're going to go into the purpose of the robotics program and specifically the purpose of why you're here in developing a robotics program. Remember, we talked about the 7 elements. This is one of the essential 7 elements. You have to have a purpose for your program and you have to make your membership aware of what that purpose is. A lot of times people don't understand. They just think, oh, well, we're putting together a program. It's like, yeah, but why are you meeting? What's the point of this? It always drove me crazy whenever I would show up at a meeting and I would say, well, why is this meeting? It's like, well, or why are we having this meeting? And people would say, well, because we've always had this meeting. It's like, really? Well, maybe we need to figure out why this meeting even needs to be here. Because if it isn't, then let's get out of it. Let's get out of it and do something more meaningful with life. Life is too short. You got to have a purpose. And if you're going to be sitting in a meeting with a robotics program, make sure it has a purpose. Don't waste people's time. So why a structured program, though, specifically? And we talked about a lot of different programs out there, but we're talking about a structured program. We'll go into exactly what structure means. But for the purposes right now, just remember that there are a number of elements that make up a structured program. And if you have those elements, it has better outcomes for the program specifically, and also especially for patient care and for costs and other types of metrics. So what we did is we looked at this and we wanted to know what exactly are people doing out there in terms of a program that is creating a better outcome. And so we surveyed all of our programs, wanted to know what they were. Some programs would have a robot at their hospital, and they would say, I'd say, why do you have a program? Or what is your program? They'd say, well, we have a robot, so we have a program. No, that's not it. A program is very different because other people who are getting much better outcomes were doing something different. And when we started surveying them and asking them specifically what they were doing, it's amazing how all of a sudden it started to come together. And we ultimately found through the surveys there was 22 elements that seemed to be making up the program. I further refined it down to 7 elements, but I'll show you talk to you about the 22 elements later in the program. But suffice it to say for right now, why it was important for identifying what structure meant. The reason is because less structured robotics programs had a complication rate that was 46% greater than robotics programs that were highly structured. And so this was, we were using the Premier database. We were using the Select data. It's just a way that they do their type of analysis. And the great part about that particular database is that it is risk adjusted and benchmarked across the United States. So we had some pretty good indication. Then we saw that the complication rate was 46% greater at less structured programs compared to highly structured programs. There was something really real happening here. We also found that less structured robotics programs were found to have costs that were 37% higher compared to highly structured programs. Think about that. The two critiques that I hear regarding robotics programs have always been that they had higher complications and much more costly. But I've never seen anybody go back and say, yes, but when you adjust for program development, what was the outcomes? And I've never seen that on paper, and that was the part that was really bothering me. And like I said, I had access to a tremendous amount of data. We did a huge amount of number crunching on this, and I had a lot of support in being able to look at this. And what really struck me is that we were seeing data within our organization that was showing these types of outcomes when you had a structured program compared to when you didn't have a structured program or had basically no program. Like I said, some of the programs, they just simply said, well, we've got a robot, therefore we have a program. And as it turns out, that is completely false. You don't want to get into that way of thinking that just because you have a robot that you've got a program. Programs are highly structured, and I'm going to teach you how to do this highly structured program in this course. So if you want to improve patient care, resource utilization, costs, then develop a highly structured program. Just like Peter Fine used to say, leadership matters. Well, I'm going to tell you some programs matter. We've got data to support it, and as I have talked to people about this over the last about year and a half, I've been getting a lot of feedback in terms of other people noticing the same observation, and that is that it's not just me. I went down to a program and observed what the Texas Institute of Robotic Surgery was doing. Guess what? They've got a really, really highly structured program, and guess what? They also get better outcomes. Surprise. And since then, I've met a number of people out there who have also confirmed this as well. This is unfortunately right now a big secret, and that is how do you develop a structured program? Everybody has their own way of doing it. I'm going to describe to you one way of doing it. You'll find other people who will give you some other ideas about how to do it. But I think what you're going to discover is that no matter how you end up doing it, having a structured program is actually going to end up producing much, much better outcomes and a much more successful program for you and your patients. So this is a different way of looking at it. Some people like to see it written visually. Some people like to see it as a graph. And so I'm just showing you the graphs between the two programs. And what you're seeing is on the left, it's the complications. We looked at observed to expected outcomes for robotics cases at these different facilities. And we compared those that had greater than 75% of the elements. Remember the 22 that I described earlier, the 22 elements in a survey. And what we found was that if you had greater than 75%, your observed to expected complication ratio was markedly lower compared to those that had less than 75%. And so it was a 46% difference in complication rates. Remember, in a risk-adjusted and benchmark fashion. That's a huge difference. And so when I hear people saying, well, robots tend to get worse outcomes, it's like, tell me about your program. And they go, well, we've got a robot. And I go, that's the first problem right there. You don't have a program. And so if you're complaining about your complications, guess what? Your programs do matter. And so that's going to be a big piece. The other thing I also hear about, it isn't just physicians complaining about the cost. I hear a lot of people in the C-suites and the finance offices who are also complaining about the cost of the robot. Remember, that's how I got involved in this. Was we wanted to know, is the cost really worth it? And what we were discovering was that it depended on who you looked at. And in some facilities, they were telling everybody about why their costs really weren't that bad, and that really they thought that it was really worth it. And other places were saying, oh, the costs are just killing us. And you can see what happens. You don't have a structured program, guess what? It costs more than a third as much. Isn't that amazing? Just by having a structured program in place. And so when people ask me, are you agnostic on this whole robotics thing? And I say, yeah, I'm not agnostic anymore, because I really do believe that if you have a structured program in place, you're going to get better outcomes. And if you don't have a structured program in place, you're going to get worse outcomes. And so when we start to compare these, I want to know, do you have a structured program or not in place? Because if you do and you're still getting bad outcomes, okay, there's some work to be done there. I just don't hear that anymore, though. What I find is those that do have the program in place generally tend to get better outcomes. And that's just been a consistent finding I've observed. So if you're going to do it, get serious about doing this. I mean, I really think that this is not go out and buy a piece of equipment and park it in your operating room and hope for the best. This is something you have to take serious. And by doing so, you got to wrap a program around your robot. That's the way to do it. You want to get the outcomes? That's the way to do it. And I'm going to show you how to do it in this course. So here's potential savings. And I had to put in a bunch of assumptions, and every program's different. Everybody's going to have different margin per case, and everyone's going to have a little bit different case mix and payer mix and things like that. But I had to pick something, and I just figured, well, based on what I was able to see, and what are potential savings? And you could go in and do this math on this one yourself, but this is the kind of slide you want to show to your CFO and say, hey, tell me what the margin per case is on these, and we can look at a 27% reduction in costs. What's the potential savings based on this across our organization? And the potential savings is on the on the y-axis, and the annual robotic cases is on the x-axis. And so if you're a relatively small program, you're only doing, maybe you got one robot, you're doing about 250 cases, you could save over $100,000 a year just by having a program. If you're a busier program and now you're doing 500 or 750 cases per year, 750 cases, now you're going to save $400,000. If you're doing 1,000 cases, it's well over $500,000. And that's just pure savings, purely by having a structured program in place. So if someone comes back and says, so what's the upside of this? Particularly someone from your business office and wants to know what the upside is. Say, look, here's the upside. We could save a substantial amount of money. And this isn't even talking about the reduction in complications, the reduction in length of stay, and the reduction in readmission rates. This is just purely in terms of savings. And so you're probably thinking, wow, but how much does it cost to implement a program like this, Terry? It's got to be, hundreds and hundreds of thousands of dollars. And what I'm here to tell you is that we implemented our program across our system using existing resources. There was no additional FTEs, so full-time equivalents. We didn't have to hire any new employees. We didn't have to go out and buy any special equipment. We didn't have to do anything. what we did is we built this purely on existing resources with the talent that we had in the organization and with the resources that we had. And we'll talk about the types of resources I think are really fundamental for developing these programs. But just about every healthcare system in the country is going to have access to these type of resources. And I've got some ways of getting around that too if you don't have some of the high-tech ones. But for the most part, you don't need the high-tech stuff. You can do this simply by a group of people sitting around looking at data and helping improve your program through performance improvement. So this is the slide that you want to save for your CFO, because they really should see this. So purpose defined, I really had to define it in some way. The purpose of a robotics program is to, I think the number one thing is improve outcomes for patient care. That's obviously the why we're in healthcare. That's why I got into medicine. That's why I got into surgery. I want to see people get better as a result of things that we're doing to improve their care. I think it's also to optimize the utilization of robots. I saw another trend, and we'll talk about that when we get into some of the other metrics and things like that. But I saw another kind of concerning trend with utilization, and that is people weren't necessarily utilizing them correctly. And when you do that, that's part of how it creates the increased costs and problems, particularly among scheduling and with surgeons. And I think there's a way to work around that. I shouldn't say work around. It's probably more how to do a better way of doing it. I think it's to work to decrease the total cost of care of surgery. I trained initially in the era of a lot of open surgery. We were transitioning into the minimally invasive laparoscopic approach during the early part of my training, and it was interesting to see, the high costs of minimally invasive surgery. But when we started looking at the total cost of care of minimally invasive surgery, we began to realize that we were ultimately reducing length of stay, reducing overall costs, and getting lower complication rates based on the minimally invasive approaches. So there's something analogous happening here in robotics, and I think we have to keep our eye on it too. I also think it's to enhance the workplace experience of the staff involved in providing care to patients undergoing robotic-assisted surgery. We don't like to talk about this. I can tell you as a surgeon, if I had to go in and scrub on a 12-hour case, you'd go home at night and you're just sore and aching. And the thing is it's not just a 12-hour case. It could be a 3-hour case, because some 3-hour cases will feel like 12 hours, And what I'm hearing among surgeons is they don't have that as much anymore when they use robotics. It's much more pleasant to sit down and work on a robot using your hands than it is to stand up and have to be working at all kinds of odd angles and stuff like that. Not only that, but the visualization is better, and I think there's a lot of other potential enhancements to this that make robotics a lot more user-friendly for surgeons over time. So I think that's part of what's happening, and it's up to us to make sure that if that is what's happening, we should be supporting it. The one I always think of is they say, well, the surgeons are sitting down operating. I'm like, yeah, they're sitting down operating, but remember, the hand surgeons figured this out decades ago, that setting up some chairs and sitting down was a lot easier way to operate on the hand. And I think the same thing we're going to discover is with a lot of other things in surgery, that if we could sit down and operate, we probably would prefer to do it that way. I just don't think anybody's going to walk into the operating room once you've got a robot and say, we're going to take that away from you. There may change it. There may be a different type of robot. There may be a different type of way of doing it. But there's just something about that. We would never walk in and take the chairs away from the circulating nurse and the anesthesiologist. I mean, there'd be an uproar if you took the chairs out of the operating room for those folks. So if you do it for surgeons, I think you're going to have some pushback as well. So it'll be kind of interesting to see what happens over time with this one. But I do think that we have to find ways of extending the useful life of a surgeon. And I know that's such a crappy way to think of it, and that is that that we're almost treating them like they're a piece of equipment. But what I'm seeing is an enormous amount of burnout, not just among surgeons, among all physicians, but particularly among surgeons. And I think that's really disheartening at times when I see a surgeon who's really suffering as a result of burnout and other things happening within the work environment. It's just, we can do better. We really should. And we should be making that one of the reasons why we're meeting as a group, to try to figure out how we're going to make this a better and safer work environment to work in. So I think that should always be one of the purposes. I also think it should support the best practice use of the robot, and that is figure out what's the best way to use it. Not necessarily why we should use it on every case. I don't think we should. In fact, I think just the opposite. I think that it has very, very specifically defined uses. And as we learn that, we should make sure that patients get access to the robot who really are going to benefit from it. And if we're finding where it's not necessarily being a benefit, then we should probably find other ways to do it. And I don't think that's a bad thing. I think that's just a thing that we do in healthcare, which is in medicine in particular. And that is that we learn how to do it better over time. And I think that we're going to see this, but we have to put that down as a purpose because I think that's one of the things we should be doing. So as usual, if you need to get a hold of me, there's my email address and there's my website. Feel free to contact me with any questions. I really appreciate it. And thank you very much for listening to this program. And please move on to the next section and enjoy. Thank you very much. Bye-bye.